Tom, so what can be done with these vaccines?
Yeah, Joe, it's not an easy question to answer, but it's one that the government has asked Jane Holton, the former Secretary of the Health Department, to have a look at as she takes stock of Australia's vaccine situation, both Australia's vaccine procurement and current suppliers, to decide whether they're adequate or not. But there is no doubt that Australia will have tens of millions of COVID vaccines simply left over. As an example, Australia purchased about 51 million Novavax vaccines. About 160,000 have been administered so far, months after they started being rolled out. Now, many will go into Australian arms still. Third doses and fourth doses are now being rolled out, but the preference from ATAGI is that mRNA vaccines be used in the first instance there. Now, of course, earlier in the pandemic, there was great demand for vaccines overseas. And still in many low-income countries, vaccination rates remain very low. But these days, there's a bit more of a surplus abroad. There's a bit of a glut of vaccines worldwide. So it's not as simple as just going ahead and donating those vaccines. Now, Australia can, of course, still try and renegotiate contracts with vaccine suppliers too for vaccines that haven't been delivered as yet, perhaps to change those contracts and see variant-specific boosters delivered instead. But these are complicated private contracts the government will have to work through. But Jane Holton has spoken on this morning and made clear that there is an oversupply of vaccines, not just in Australia, but worldwide. She's not critical of the way Australia procured those vaccines, but she is clear that some are simply going to go to waste. Here's a bit of what she had to say.
There is a global supply of vaccines which will not be used. The way I like to think about this is the premium, the price that the world has paid to actually get the vaccination level globally up to 61%. And yes, some of these vaccines will expire. That's not necessarily a bad thing. What did we value here when we were in the early stages of the pandemic? We valued speed.
And Tom, some experts want a different approach taken in future.
Yeah, Joe, some experts are critical of the way Australia procured its vaccines early in the pandemic, saying that, like many wealthy countries, Australia simply bought far too many vaccines. Others say, given the uncertainty at the start of the pandemic, those, very uncertain first few months there, Australia took an understandable approach of buying a large number of options for vaccines in case some simply didn't come through. But Professor Brendan Crabb from the Australian Global Health Alliance says there is certainly room there to review how Australia performed in those early months and see what we can learn from that to do differently when it comes to buying variant-specific boosters in future or when the next pandemic rolls around, whenever that may be.
The emergency of a pandemic, it makes sense to have given ourselves a lot of options, but we do need to review that very closely and decide how we can do it better next time, because there's nothing more tragic than to literally throw out life-saving vials of vaccine.
Joe, the main thing many experts want to see is a more collaborative approach taken between Australia and other wealthy countries when it comes to procuring vaccines, rather than competing against each other and buying up vaccines, for a more equitable approach across the globe.
Okay, Tom Lowry reporting there from Canberra.